Hi, I'm Dr. Jocelyn, and today is our special topic, so listen to my words carefully. Have you ever caught yourself standing in front of the mirror or noticed in a quiet, private moment that things just don't feel as robust as they once did? Maybe it wasn't sudden, maybe it crept in slowly. A subtle loss of fullness, a delayed response, a feeling that something you once took for granted now requires more effort, or worse, doesn't respond at all. And if you're being honest with yourself, maybe a small voice in the back of your mind has already started whispering something dangerous. This is just aging. This is what happens after 60. I guess this part of my life is over. I want you to pause right there because that belief is not only incomplete, it's often wrong. What if I told you that one of the most powerful tools for restoring blood flow, fullness, and vascular responsiveness has nothing to do with blue pills, injections, or expensive supplements hiding behind flashy marketing? What if I told you it's already sitting in your kitchen, likely right next to your flour? I'm talking about sodium bicarbonate, plain, simple baking soda. Now, I know exactly what you're thinking. How is something I use to bake cookies supposed to help my performance? Stay with me because today I'm going to walk you through 5 clinically grounded, often overlooked ways bicarbonate can support vascular health and what happens to size, responsiveness, and confidence when blood flow is no longer restricted. If you're in your 60s, 70s, or beyond, and you feel like your edge is slipping, know this: you are not alone, and you are not broken either. In many cases, what you're dealing with isn't permanent loss. It's restricted circulation. Think of it like rust in the pipes, not damage to the system. Before we go any further, take 2 seconds and let me know in the comments where you're watching from. Men tune in from all over the world, and seeing that community matters more than you realize. And if you believe men deserve shame-free, evidence-based health information, hit the like button now. It helps this video reach men who are struggling silently. Everything we discuss today is educational, clinically informed, and designed to support, not replace, care from your personal physician. Let's address a damaging myth head on. There's a widespread belief that once a man passes 65, his body naturally shrinks, weakens, and shuts down, and nothing can be done. That is not biologically accurate. In many men, what looks like permanent loss is actually vascular restriction. Imagine your arteries like garden hoses over decades. Inflammation, oxidative stress, and acidity create stiffness like a kink in the hose. Pressure drops, flow decreases, responsiveness fades, tissues appear smaller, but the hose itself hasn't disappeared. It just needs clearing, not replacing. Now, let's talk about why so many men think nothing can be done and why that's misleading. Your body isn't broken. Often, the problem is vascular restriction, not permanent decline. Think back to those garden hoses. Over time, inflammation, oxidative stress, and acidity create stiffness. The pressure drops, blood flow slows, tissues respond less, but the system itself is intact. It just needs the right environment to work properly. This is where baking soda or sodium bicarbonate comes into play. Your skin is not a solid wall, it's a semi-permeable membrane. When tissues become congested with metabolic waste and localized acidity, elasticity suffers. Blood vessels beneath the surface struggle to expand. Using a localized alkaline soak, you can gently rebalance tissue pH and reduce inflammation. The result? Microcirculation improves, elasticity returns, blood volume increases naturally. It's like removing a tight rubber band from a sponge. Suddenly, the sponge can absorb again. Here's a simple method: 2 tablespoons of aluminum-free baking soda in warm water. Soak for 10-15 minutes, 2 to 3 times per week. Avoid broken skin or active infections. Rinse thoroughly afterward, and moisturize if your skin feels dry. Men often report something unexpected here, not just a physical change, but psychological relief. When tissue looks healthier and responds better, confidence starts to return quietly, naturally. As we age, kidney efficiency declines. This contributes to low-grade metabolic acidosis, a condition linked to muscle fatigue and vascular constriction. Acidic blood tightens vessels. Baking soda acts as a buffer, nudging your internal pH back toward balance, signaling smooth muscle tissue to relax. Relaxed vessels mean better volume, better response, less internal resistance. A simple dosage: 1 teaspoon in 8 ounces of water on an empty stomach in the morning. If you like, add lemon for taste. If you have high blood pressure or sodium restrictions, consult your doctor first. Many men describe this shift as feeling fluid again, like releasing a parking brake they didn't even know was engaged. Once internal pH is balanced, the body becomes more responsive. This explains why so many men use nitric oxide boosters, beet powders, L-arginine, and prescription medications, but still see inconsistent results. Those tools work, but only when the internal environment allows them to function. This brings us to one of the most overlooked points in male vascular health: protecting nitric oxide. Nitric oxide, or NO, is the master signaling molecule for blood vessel dilation. It tells your vessels, relax, open, let blood flow. But NO is fragile. In an acidic, oxidative, inflamed bloodstream, it breaks down immediately, like trying to light a match in a windstorm. Bicarbonate doesn't make NO directly, but it creates a calmer internal environment where NO can remain active longer. The result? Sustained dilation, consistent blood volume, and a sense of reliability returning. Let's continue. Once nitric oxide is protected and your internal environment is calmer, everything changes. Instead of a brief response followed by rapid fade, you get sustained dilation, more consistent blood volume, and reliability returning. And that consistency isn't just physical, it's psychological. When your body starts responding predictably again, you stop second guessing yourself. You stop feeling like you're wasting money on supplements that don't work. You stop feeling betrayed by your own physiology. You regain trust in your body. Here's how to use this strategically. Take 2 teaspoons of bicarbonate in water about 30 minutes before nitric oxide boosting foods or supplements. Think of bicarbonate as the stage crew preparing the environment so the main performance, the dilation and blood flow, can actually happen. This isn't about chasing extremes. It's about maintaining a steady state of readiness. It's about being functional, consistent, and confident. Now, there's a medical term you may not have heard before, but it explains a lot of what men experience after 60. Inflammaging. Chronic, low-level inflammation slowly builds over decades. It doesn't cause sharp pain or emergencies, but it quietly changes tissue structure. Over time, it leads to fibrosis, the buildup of stiff, non-elastic tissue. Even with perfect blood flow, fibrotic tissue cannot expand properly. Imagine trying to inflate a balloon made of cardboard instead of latex. No amount of pressure will restore flexibility unless the tissue itself becomes healthier. This is where bicarbonate steps in again. Studies show it lowers inflammatory markers like C-reactive protein, helping reduce the slow destructive process. When inflammation decreases, tissue elasticity improves, expansion capacity returns, and comfort increases. This isn't just about function, it's about dignity. Realizing that your body can remain healthy, responsive, and intact well into your 70s and 80s is empowering. It reminds you that aging is something you can participate in, not something that just happens to you. How do you apply this safely? Follow a pulse approach: 1 teaspoon of bicarbonate daily, 5 days on, 2 days off. This prevents dependency and allows your body to maintain its own buffering systems naturally. Many men also report that along with physical changes, they notice reduced performance anxiety. When your body responds more predictably, your brain stops expecting failure. Anticipatory anxiety fades, and suddenly your body feels like an ally again, not an opponent. For the most powerful results, combine bicarbonate with potassium citrate. Together, they create a synergistic effect. Potassium balances sodium, preventing unwanted water retention, while citrate further alkalizes urine and blood. The result is a gentle, systemic flush. Think of it as clearing static from a radio signal. Suddenly, communication between your brain and blood vessels becomes clearer. Men often notice improved morning responsiveness when they follow this simple routine: 8 ounces of filtered water, 1 teaspoon baking soda, juice of half to 1 fresh lemon, about 20 minutes before breakfast. Now that you understand why bicarbonate works, how it supports vascular health, and where it fits into the bigger picture, it's time to make this practical. Knowledge without action only creates frustration. So what do you do tomorrow morning? Let's build a simple, realistic plan. Nothing extreme, nothing expensive. Just a structured approach you can actually follow. Phase 1, clear the rust. Every morning, take 1 teaspoon of baking soda in 8 ounces of water with a squeeze of fresh lemon about 20 minutes before breakfast or coffee. That's it. No stacks, no chasing sensations. During the first 2 weeks, some men notice improved digestion, less morning stiffness, and a slight warmth in the pelvic region. These are signs that microcirculation is improving. Phase 2, improve tissue elasticity and responsiveness. Continue the morning tonic and add a warm bicarbonate soak 2 times per week for 10 to 15 minutes. This phase allows internal changes to translate into structural improvements. Remember, the morning drink is the most powerful lever. Everything else is additive. Be realistic. You won't wake up tomorrow with the body of a 22-year-old. Expect gradual, cumulative improvements: warmth, fullness, better morning responsiveness, consistent performance, reduced anxiety around function. These changes are sustainable, and that's exactly what we want. What you're really doing is sending a signal. I'm paying attention, I'm invested, I'm not giving up on myself. Men in their 70s and 80s maintain remarkable health because they respect the small details: internal pH, inflammation control, vascular consistency. These things compound. Don't suffer in silence. This is biology, not embarrassment. Aging doesn't mean surrender. What you've experienced is a shift, not a sentence. You have options. You have agency. Follow the plan, and vitality becomes a practice, not a destination. With consistency, patience, and care, you can protect function, confidence, and dignity well into your later years.